Hey everyone, I'm Dr. Eric Baker. I'm a physician, I'm a dentist, I'm an oral and maxillofacial surgeon, and today we're going to be talking about mewing. And really, does mewing work? Well, there's nuances, like with anything. As an adolescent, it might. It can promote certain growth. As an adult, it will certainly not work. When I see all these photos of people and their before and afters of, a couple of years of mewing, look at how different I am before and after, most of those cases you see the person dropped about 30 pounds. And that's the reason that their jawline looks really, really good. In an adult, mewing really does not do anything, not anything productive anyway. In an adolescent, it may promote some growth. So mewing is based on this Dr. Mew, who's a British, I think he would refer to himself as an orthotropist, not an orthodontist. And he coined or invented this technique where you put the tip of your tongue to the back of your front teeth and then put the posterior part of your tongue, the back part of your tongue, up against your palate, swallow the saliva out of your mouth and have your lips sealed, basically putting your tongue posture up into your palate. And he purports that this will promote facial development that improves your jawline. And this is probably true in the growing adolescent, in a young kid who is growing anyway. Most people my age would remember kind of headgear, that orthodontists used to put on people. You'd put a brace on their head or on the back of the neck, and they'd have these wires that would be pulling on the upper jaw or the lower jaw, essentially doing the same thing, where it's kind of promoting growth in a direction that you want it to. Our teeth come into place based on the pressures that are around them. So let me explain what I mean by that. So you have an upper lip, and we'll talk about the upper teeth. You have an upper lip and you have a tongue, and your teeth come in place right where that is, in between those two, based on the pressures from your tongue, pressures from your lips. If you've ever seen someone who is maybe syndromic, has a very large tongue, you look at where their teeth are, so they have much more pressure from their tongue because their tongue is large, and it flares out their teeth and pushes their teeth outward because the tongue pressure is overcoming the lip pressure. So the teeth flare out. This is kind of a similar concept. So if in adolescence you're kind of promoting that by putting your tongue up and pushing, you're going to promote the kind of growth that kind of does. There's some dangers there though. If you're pushing on your teeth with your tongue constantly, your teeth are going to move. If your bones are fused, and your bones fuse at some point, they're not just going to grow forever, right? Like we stop growing, and after you've reached adulthood, if you do this mewing technique, you're just going to move teeth. You're not going to move bone, just teeth. And you can push your teeth right out of your bone, right? So you can take your teeth and put pressure on them repeatedly and flare those teeth out, which in a minor way can just create spaces in between. You think about if you took that row of teeth and you pushed them out, they would splay out and you'd create spaces in between your teeth. So that would be a minor thing. A more major thing would be you continue to push them and you just push them right out of the bone. What would happen is you would start to get recession up your teeth and you'd have a very unaesthetic look. You don't want that. So I think that there needs to be some caution when it comes to some of these things, these fads that we can see roll through social media. Is it going to hurt you to do some mewing occasionally? No, it's not going to hurt you. And if you want to take a photo with a mewing posture so that your jawline looks better, I think that that's fine. That's not going to do anything wrong for you. But if you're going through extended hours at a time of doing this, it can be damaging. The second thing that I would say is part of this process is swallowing all of your saliva and really sealing off your mouth. Well, why do we have saliva? Saliva is meant to bathe our teeth in calcium. So there's protective factors within our saliva that keep our teeth hard and make them solid, like calcium. And so if we remove the saliva from our mouths, then we have a much higher chance of having decay, of dental decay. because the protective factors that God gave you to protect your teeth are not there anymore. And so I would caution people for that reason as well. There's been studies done on baseball players that don't chew tobacco, but do spit all the time. They spit all the time, right? Just because it's like habitual. It's a thing that baseball players do. So if you spit all the time, don't use tobacco, there's a higher likelihood of causing oral cancer as well as having decay just from spitting, just because you're removing the saliva from your mouth, the protective factors and enzymes that your own saliva has to keep your mouth clean and keep bacteria from overwhelming it and even carcinogens. So again, I would caution people from maybe getting too overzealous on some of these things. A little bit of it's going to be fine. A lot of it, probably not.